Thank you very much, Judy. And I also would like to welcome everyone. Thank you very much for joining us on this very special day, the first Learning Lab day of iMessage Delivers 2021. We're very excited to show you this PCS Virtual Learning Lab presentation. My name is Balázs Modaványi, and I am CEO and co-founder of PCS. Today, we're going to show you the next generation of virtual patients using artificial intelligence. We are going to review some key elements of the theory behind these AIs, as well as see them in action. During the next 60 minutes, we are going to cover first a quick intro to artificial intelligence and machine learning delivered by yours truly, which is going to be followed by a hands-on demonstration of an AI-enhanced virtual patient by Nick Stoik, our VP of Sales. And finally, we would be really happy to answer any questions you may have for us about virtual patients, AI, or anything else, really. So with that, let's get started. Let's start with theory, and let's jump into our introduction to AI. In this segment, we're going to talk about what artificial intelligence, also known as AI, is, why it is important to simulation professionals, and we will get a quick primer on the current techniques of AI development. Finally, we're going to assess how the AI of today is relevant to patient simulation in 2021. So what is AI? Well, the definition is pretty dynamic, to be honest, and then it changes over time. And it's a little bit soft in the sense that what we mean by AI is that the usual definition is that any technology with sufficiently human-like capabilities to feel like magic at the time. It is technology that either has been developed recently or one that we expect to develop in the near future. So if you're looking at the timeline of how this definition evolved over time, 30 years ago, computers playing chess, that were definitely qualified for being AI. Today, it's so common that we don't really see it as such. 20 years ago, automatic document summarization was AI, state of the art. Today, every newsroom uses such tools. Only 10 years ago, computers recognizing images at human levels was AI. Today, we can all search all our photos by the person in the picture using those technologies every day. So we should expect the perceived definition of what qualifies as AI to continue to shift in the future as well. So beyond that it feels like magic, what can we tell about AI? AI really is a spectrum of capabilities, not one particular ability. These range from narrow AI with a single capability to strong AI or artificial superintelligence, which is far more general by its very nature. All of AI today is either weak or narrow AI. And to be honest, nobody really knows when or even if strong AI is going to be possible. Having said that, on the other hand, we have yet to see any hard reason to believe that strong AI is impossible to create. So as of today, we have every reason to believe that eventually we might as well get there. The technologies behind AI, those changed over the decades of AI development quite substantially. Yesterday's solutions are just insufficient for today's AI problems as the definition of AI evolved. So there is a long history of AI and the related technologies. AI is definitely not a new thing. The basic concepts were developed at the very beginning of the computer age in the late 50s. Most experts at the time strongly believed that we are only a few decades away from building strong generalized AIs, which is very interestingly exactly how many experts believe today how far we are from reaching that ultimate goal of AI development. However, this, of course, is no reason to question the progress that has been made in the last 60 years. We just don't really know exactly how much closer we are to strong AI today. The first 30 years of AI research focused on something known as symbolic AI, which is based on a high-level symbolic, meaning human-readable representations of problems. After some initial success in various fields like chatbots, playing chess, and natural language processing, seemed like that approach has reached its limits and progress halted. And that's when the AI field experienced the first AI winter, a period of disillusionment when AI was no longer seen as the next big thing, but rather a dead end with no real breakthrough in sight. About 20 years later, in the 90s, increasing data processing and storage capabilities of computers paved the way to an entirely different approach to AI called machine learning, or ML. So what is machine learning? At the gist of it, machine learning is about setting up computers to learn something on their own without providing explicit instructions. We, the human programmers, establish some models, provide the data, and then the computer gets to work to adjust the model until it really fits and solves the problem as represented in the data. Today, almost all machine learning systems use some form of neural networks as the model they are based on. So what are these neural networks and how do they work? Well, although they were indeed inspired by nature, they do not really resemble, God forbid, simulate biological neural networks. Rather, they are very abstract mathematical representations of limited small-scale networks of neurons. That is still very dry. Let's see. A neuron in this model is essentially a simple little number cruncher. It has some inputs where it gets some numbers, and based on its inputs, it generates some outputs where it outputs some numbers. Each of the gray dots here in this diagram represent a single neuron. The magic is in the connections of neurons. These neurons are all connected and put to a subset of the other neurons. So the output of one becomes the input of others, and this is how they form networks. All these neurons can be described by how they tweak their inputs to generate their outputs. So what's the rule for the number crunching, basically? The connections of the network and the output functions of the individual neurons all together define the characteristics of this neural network, i.e., what input is going to trigger what output at the network level. So how do we get the neural networks that are useful? Useful in the sense that on their outputs, they can indicate some form of insight about their inputs. Surprisingly, we get there pretty much by chance and with some evolutionary tweaking. First step, let's grab a bunch of neurons and connect them pretty much completely randomly and accidentally. Then we start feeding the inputs of our data set and check the output. Finally, let's make minor adjustments to the neurons and their connections, and let's try again and again and again, many thousands of times. Think of this process as a rather crude and inefficient form of bot manufacturing, one that gets us to the best possible single bot for the task by building thousands of different bots using trial and error, and then finding the single best one and throwing away the rest. In this metaphor, a bot that has some skill and represents a certain neural network. Our factory of bots, really just a piece of software, needs to build a lot of these bots neural networks, train them by setting neurons parameters and connections, and test them to find to fit the best ones. Once the best ones are good enough, we throw away the rest of the bots and our bot manufacturing is complete. Okay, this still sounds all too theoretical. Let's see an example. Mandatory disclaimer before we dig into that, we're going to oversimplify many things in this example as we have to complete our overview in minutes, not days, but we are going to cover enough detail to gain some really interesting insights. Okay, so let's imagine that we are set out to build the most useful neural network of them all, one that identifies kitten pictures on the internet. After all, isn't sending around kitty pictures the #1 reasons for the existence of the internet? Of course it is. First of all, we need to find a way to feed all our pictures into our neural network, which can only take, as we previously mentioned, numbers as its input. How do we do that? It's actually pretty easy. Let's just break up those pictures into pixels, as you can see on the first image here, and take the numbers that represent the intensity of color for that particular pixel. As you can see in the second image, this means that our picture is now a nice long series of numbers, which we can use as inputs for a neural network. So that part of the problem is solved. We have a bunch of numbers that we can use as input for the neural network we're building. Okay, let's get back to this somewhat confusing diagram of a neural network. As we build a neural network that takes a numerical representation of our image, color values of each pixel, as its input, and this network is only going to have two outputs, which we're going to name this is a cat and this is not a cat. Our goal is to get the insight of the neural network in the sense of how likely the input is to be a cat or not to be a cat indicated on these output variables. This is because neural networks really work best when they do not try to make black or white decisions, but rather give us probabilities, likelihood of their predictions, how sure they are in their insights. This allows for more flexibility, can use mistakes as learning opportunities, and can help us avoid overtraining to our initial sample data set, which is going to be really important later. So this is why we feed our network with a cat picture. We would, when we did that, we would like our neural network to give us a big number on the output, like a close to 1, high probability, this is it. On the output, this is a cat. And if everything worked great, just to check things, we also get a really low number, a low probability of on this is not a cat, because the input actually was a cat. So this is not a cat output should indicate that, hey, we really don't think that this is not a cat. So actually it is a cat. Let's see how we can get there. So that looks like that's simple neural network. If we have that network, everything is going to be great, right? That's simple. However, the problem is that our neural network has no idea how cats look like when we get started. We just started with a random bunch of neurons, arbitrarily connected. So it is going to give us pretty much a random numbers on its output, no matter what we feed into it. This is not really useful for differentiating between pictures of cats and pictures of dogs or anything else. That's not good enough. So what do? We need to generate and then try an enormous number of neural networks and pick the ones that seem to be slightly better than random at picking cats. How do we check that? Well, we feed all of these random generated neural networks with as many cat pictures and as many not cat pictures as possible. And keep an eye on their outputs for all those pictures. The more cat pictures we show them, the more likely that we will find bots that will be able to later deal with pictures of kitties they have never seen before. As they learn to perform well with a larger training data set, they are becoming better at some form of generalization. This is why the amount of training data is absolutely key to machine learning. The networks that seem to be better at the job are then slightly adjusted and tweaked and tested again, always testing their performance in identifying cats as well as identifying the not cats. We need to avoid false positives too. We continue to alter our network until we reach a satisfactory level of performance. So what do we get as the end result? Essentially, a particular network of specifically configured number crunching neurons that does a shockingly good job of identifying cats, even in pictures it has never seen before. Yet, it has no idea or concept what a cat is or how a cat looks like. For example, it doesn't have thoughts like cats have eyes or they have 2 ears or anything like that. Surprisingly, neither our neural network, nor the computer programmers, nor the test process have any idea how our network works. We just found this network that does this job pretty well through experimentation. These machine learning neural networks are in some ways much more simplistic and in other ways more capable than biological neural networks. So the parallel really breaks down on many, many levels. It's really just an easy way to talk about them, to see them as neural networks. However, it's still somewhat difficult for us to resist the temptation to see the millions of these rapid adjust, test, repeat training cycles as some form of accelerated evolutionary selection process. The capabilities of the computers running our neural network limits the scale of the neural network and probably its abilities. Too much complexity would result in really long and as such highly impractical training times. Although the number of neurons is not a good way to evaluate the capabilities of a machine learning neural network. And we have no idea whether our simplistic number crunching approach simulates all what's really important and relevant about the biological neurons. It is still interesting to see how our artificial neural networks compare to live ones in scale. Today's state-of-the-art AI systems use neural networks, often multiple neural networks in one system for various sub-functions of the system. So those networks are made up of several hundreds to several thousands of neurons. This is roughly the scale of the nervous system of a jellyfish, about 5,300 neurons. And this is still dwarfed by the brain of a lobster, 100,000 neurons, not to mention a rat with 100 million neurons or a human with roughly 100 billion neurons. So as you can see, machine learning neural networks are relatively tiny when we compare them to their biological equivalents. So as of today, we're essentially teaching a jellyfish to drive a car or to transcribe audio or to recognize pictures of cats instead of doing all the things that jellyfish scale nervous systems normally do in biology. So this is surely challenging and amazing that it sometimes somewhat works, and no wonder we have no clue how it is doing it. Machine learning algorithms embedded in these bots are everywhere and are transforming our expectations and our relation to technology in a wide range of applications. Such bots trade stocks, pick our next video and social networks that we should watch, attempt to alter our political opinions and recognize us and unlock our phones. Machine learning is here to stay with some amazing capabilities powered by internals that nobody fully, truly, deeply understands, which is kind of mind-blowing. Machine learning-based solutions are becoming ubiquitous in all fields of healthcare. We see startups, established companies, and research institutions offering AI-enhanced tools for various aspects of health science research. patient and doctor assistance, telehealth applications. Machine learning is being seen as an enabler for technology to break into fields that were previously too complex, too fuzzy, and too confusing for computer software to conquer. This is why we see the greatest potential for machine learning in fields like medical imaging analysis, medical record data mining, and genome research. It seems like that the major established healthcare simulation companies are somewhat slow to embrace AI technologies, and there are very few companies that develop and market AI-driven simulation products. We honestly expect that to change in the near future, and those who today might still insist that AI in healthcare simulation is just an empty buzzword or an unnecessary gimmick for for now, I think they are going to give in and eventually embrace these new capabilities. So why AI in healthcare simulation? AI matters for healthcare simulation because it enables something important and definitely transformational. AI is adding a new modality of simulation. As this only happens once every decade or two, I'm sure most of you think right now that this is a pretty boastful claim. Well, let's see. Every time a new modality of patient simulation was conceived and adopted, it enabled you, the simulationists, to deliver low-risk simulated learning experiences across a new combination of simulated dimensions of real patient encounters. AI virtual patients uniquely combine some of the communications simulation skills of standardized patients and some of the physiological simulation abilities of patient simulators. Let me emphasize that traditional procedural point-and-click virtual patient experiences, just because they're placed in virtual reality or augmented reality, are not creating a fourth modality of simulation, but rather they make important advancements to improve the realism of screen-based simulation. That's great, but that's not a new modality. However, radically new AI-driven capabilities, such as natural verbal communication skills, AI-based assessment, and visual input analysis, can enable our virtual-based patients to better simulate listening, talking, seeing, and feeling. Finally, before we move on to the practice part, let's take a look at how a patient communication simulator, whether that's a digital patient or is embedded in a physical patient simulator, can actually listen and talk using these advanced machine learning techniques that we talked about. When a PCS simulator is asked a verbal question, these 5 components you see listed on the screen all jump into action and work hard to give a scenario-appropriate verbal answer. Every one of these components use neural networks, some of them multiple ones, which are constantly trained to improve their performances. When we have to differentiate human speech from other noises, we use a neural network to detect human voice activity. Google's most advanced speech recognition services utilize neural networks that are trained by literally billions of smartphone users every day. The PCS grammatical analyzer and input classifier are also driven by neural networks trained on rapidly growing data set of clinical interview questions expanded with every single PCS simulation session. Finally, when it comes to verbalizing that response, neural network-based models have been the key to some less machine-sounding voice synthesis. I hope you found this quick intro to AI technologies interesting. There is so much confusion and uncertainty in the media around AI and its impact on the future and our society for some good reasons. The machine learning driven new capabilities of computers are indeed nothing short of magical, but they have not changed the quintessential nature and the purpose of computers. They are tools to assist us. As Steve Jobs famously said, a computer is a bicycle for the human brain. To get the most out of these amazing new tools, we all have to learn how to ride the bike. In the case of AI virtual patients, this means learning how to get the most out of a smart virtual patient. Which brings us to the practice part of our workshop. And with that, I hand it over to Nick.
Thank you, Balazs. I am just going to share my screen so that everyone can see that. All right, you should be able to see my window now. So again, everyone, my name is Nick Stoic. I am the VP of Sales for PCS, and I'm going to be walking you guys through an interaction with one of our digital patients on the PCS Spark platform, Valerie Miller. So this is Valerie Miller, who we're looking at here. She's in our hospital setting, which is one of 4 different environments that our patient encounters can take place in. So to kick things off, what I'm going to do is really just start the conversation piece with her so you guys can kind of see what kind of questions she's able to understand and then how quickly she's able to respond back. So without further ado, I will kick off this interview portion. Good afternoon.
Good afternoon.
How are you doing today?
I could be better, thank you.
I'm sorry to hear that. What seems to be going on?
I've been having these horrible headaches for the last few weeks.
When did the headaches first start?
It's been 2 weeks now.
And can you describe the headaches?
They feel sharp and at the same time, they're pounding.
All right. And if you had to rate the headaches on the pain scale of 1 to 10, what would you rate them?
It's pretty intense. If I had to rate it on a scale, it's probably an 8 out of 10.
Okay. Is there anything that makes the headaches better?
Time. Rest. I'll try to find a quiet, dark room and lie down until the headache goes away.
Okay. And is there anything that makes the headaches worse?
Nothing makes it worse. I just have to get through it.
And have you noticed the pain radiating anywhere?
Sometimes it moves to the left side of my head too.
Okay. Have you noticed any changes in your vision?
Well, sometimes my vision gets blurry and sensitive to bright light during a headache. But there's no pain or any other issue.
Okay. Have you had any nausea or vomiting?
I feel a little nauseous with the headaches. Every time.
Okay. Has there been any vomiting?
In the past 2 weeks, yes. Twice when the headaches first started, but not today or in the last week.
Okay. Is there any trauma that you've had recently?
No major injuries or traumas recently.
Okay. Have you tried taking any medication for the headaches?
I usually take extra strength Tylenol or aspirin.
Okay. And has that helped?
Okay.
Has the medication helped?
Yes, usually it helps so that they're slightly more bearable.
So I'm just going to pause right there and let you guys know. So with these cases and these patient cases that we have, they're really fully fleshed out characters in the sense that we can, go super in depth with Valerie on the history of her present illness. asking all about that. But they're all fully fleshed out characters as well. So we can ask about her past medical history, her family history, social history, things that she likes to do for fun. We can also ask her about any kind of risk factors, whether or not she smokes or partakes in drugs, that sort of thing. So I'm going to keep going on this interview a little bit so you guys can kind of see how that looks. And then we'll get into the physical example.
Also, yeah, I just wanted to know that although this comes without saying to us, but nothing here is scripted, neither the sequence of the questions nor the particular form of the questions, because of course, you have no way of knowing your learners, how would they ask the questions, in what shape and form, and in what order. So that's the reason for the existence of the AI, that it can actually understand these questions in the sense that it's capable of recognizing each one of them at any given time, sometimes with some context, and answer accordingly.
Yeah, and all on that note on the context, there's always a good example I like to show, which is really neat, and I'll make a note of that when we do show it. So I'm going to ask Valerie here a few more questions, a little bit more lighthearted, just so you guys can see those. So Valerie, what do you do for work?
I am a property tax assistant at Ducharme, Macmillan and Associates.
Okay. Do you like your work?
I like it. It's quiet, steady work.
Are you married?
Yes, I am married.
What's your husband's name?
My husband's name is Peter.
Do you have children?
I have 2 kids. Ethan is 10 and Sophia is 12.
What do you like to do for fun?
I do a lot with the kids, and I like to read and cook.
Let's see. Do you smoke?
Yes, I smoke.
How much?
I smoke about a pack per day.
So I'm just going to pause that here on the context side. So this is one of the really powerful things that we're able to do with the PCS communication engine that seems fairly straightforward and simple, but it's actually quite challenging from a technical standpoint, and that is the understanding of context. So when I asked Valerie, whether or not she smoked, she responded with yes. And then I asked the follow-up question, how much, not referencing at all, in regards to if it was about smoking or not. But the system is able to still go back, understand what the previous question was, and then also use that contextual information to respond to my follow-up question of how much. So those are some of the really neat, powerful things that we can do with the PCS communication engine as well. And again, I like to reiterate this fact is that every single interaction that we're having here, basically what's happening is my voice is being recorded, that voice file is being sent to Google, it's being transcribed, we're getting that text file back, it goes into the PCS communication engine, matches it up with the correct response, and then that is then sent to Amazon to transcribe from text to speech, and then that audio file is played back to us, all in the matter of less than a second, really, because we need to make sure that obviously the conversational aspect is realistic and how quickly the digital patients respond.
And that process is exactly the answer to the first question that we received in the chat. Have you encountered any challenges with learners with accents, non-native speakers? It wouldn't be credible for us to claim that no, it works fine with all accents and non-native speakers, without stating that we are not really developing the speech recognition piece here. The element that transcribes speech into a text is developed by Google. And as you know, everybody in the world with all kinds of accents, some of them with funny Eastern European accents like myself, speak to Google tools. And these are all trained as such. And because of that, it works really, really nicely and every month better with all kinds of accents. Additionally, we have the ability to give hints to Google in this regard that hey, expect UK English or US English or South African English. when the learner speaks to them.
Great. So excellent. So now what I'm going to do is, kind of continuing along with the PCS Spark experience. So once a learner has kind of wrapped up their interview portion with their patient, they can transition into doing a complete physical exam. And that is triggered in one or two ways. The first of which can be, extremely natural, just using verbal communication to say, okay, I'd like to, take a listen to your heart, or, take a listen to your lungs. The other way is simply by clicking on the physical exam button here, and that will initiate the physical exam. So when the physical exam begins, we're going to have access to 3 additional buttons, which you'll notice up here in the top right. So we have an eyeball icon that's for a visual inspection. So we can take a closer look at the eyes, the ears, the throat, those sorts of things. And I'll show you what that looks like. So if I click on that icon here, and then as I mouse over the specific organs, you'll notice that the appropriate tool automatically shows up. And then I can just simply click down, and then I'll get that physical exam finding. So in this case, we have kind of a text interpretation of the eye exam, along with some visual images of what the eye looks like, both from just a, look close up, and then also even some vasculature of the eyeball as well. And if you, so again, you can look at, the eyes, the ears, the nose, the mouth, all of which can have this multimedia and these text kind of interpretations from the physical exam. Next up is going to be this little ear icon here. And with the ear icon, we're able to do auscultation. So we can listen to heart sounds, lung sounds, bowel sounds, all just by mousing over the appropriate part of the body, clicking down. And then you'll notice here a little log message shows up. I'm listening to the heart sounds at the pulmonic area. And you might be able to hear that on your end, but on mine, I'm hearing the heartbeat. These sounds can also be changed as well. So if you wanted to go in and create your own custom patient cases, you can actually change the heart sounds, change the lung sounds to contain pathology, basically, for whatever patient case you want to create. And then finally here, we have this hand tool. And this hand tool is really for the physical kind of palpation exam. So if you wanted to perform like an abdominal exam and palpate the stomach, you can do that with the hand tool here. It's not set up on this patient in particular, but you could go in on some other patients, click on their stomach, do an abdominal exam. But you can also check, the pulses, both the radial and the carotid with that as well. So that is the physical exam. Once the physical exam has been completed, students are then able to actually, if they find the need to order any kind of follow-up labs or orders, they can order those to kind of help cement their findings and their diagnosis for their patient. So in this case here with Valerie, we come over, we see a list of the available orders that we can choose from. So if we wanted to, in this case, order a CT of the brain, we could just check there. We could also, let's say we want to get a basic metabolic panel as well, check on that, and then click on order selected. And then immediately we have access to the CT scan of the brain, along with kind of a text interpretation, from the radiologist of what's going on there. And then for the basic metabolic panel, we also have that available as well. So we can see their blood levels and everything there. So this kind of allows them to, formalize their diagnosis for their patient. And then the other thing that I want to show you guys as well, we have the vitals section here. I'm going to come back to that in just a moment. But on the logs section here, everything that is being basically spoken to the patient, and then whatever the patient speaks back is going to be recorded in the log here. So we can see this little stethoscope icon here. That's going to be what the learner is saying, in this case, what I said, and then this little avatar icon here, that's what the digital patient has responded with. So the entire encounter is basically transcribed. So as a faculty member, you can actually go back, look at a student's session, and see what transpired during that. We can also see, if we scroll down further here, anytime that a physical exam was performed, or anytime a lab was ordered, or anytime that a heart sound was listened to, that's going to show up in the log as well. All right, so let's see, before I stop this session and show the assessment piece, I did want to just touch on this one new feature that we are just in the process of releasing, and that is our modeled physiology. So on this patient here, Valerie Miller, there's really no treatments that we need to give her. It's kind of the diagnosis in this case is a migraine. So we don't need to give her any treatments, but let's say we were running a case where it was appropriate to provide treatments with your patient. With our new modeled physiology, we actually have built-in treatments that you can give your patients, and then they will actually respond accordingly from a physiological standpoint. So we can see here, we have a full suite of treatments that students can choose from. In this case, let's say we wanted to administer some morphine. We have to choose, what the delivery method is, whether that's going to be an infusion, an intramuscular injection, or an IV injection. If it's an infusion, we have to choose the bag size, the flow rate, all of that. So that's now an option as well to make kind of the PCS Spark experience even, fully more fleshed out for students from an educational standpoint. But that's all I'm going to touch on for that for now. But we're really excited about where that's going. So then finally, what I'm going to do here before we open it up to questions is I'm going to stop this session. And then once a session is completed, a student will get automated assessment, basically letting them know, how they performed based on the criteria that's been set up in the patient case. So you can see here overall, I scored a 27%. So not super great. I missed a lot on, history of the present illness. I didn't really get into any kind of past medical history or family history, but all of that is really built out into the patient for them to find and discover. And we can also see down here, if we scroll down further, once I stop the session as a student, I can go back through the log and I can actually see what I received credit for. So if I had questions on, why did I get a point for this, or why didn't I get a point, I can really come back and see where I got my points and my credit. So you can see here, this little ribbon shows up for greeting the patient. I do get a point for introducing myself or introduction. So with that, we have...
I would like to start addressing the already submitted questions in chat.
Oh, okay. I don't see the chat since I'm sharing my screen.
Keep them coming. We are happy to answer any questions you may have through the chat window, probably the easiest way. So first question was, does it have some understanding of concepts of speech, questions, answers, or is it more just matching a database of human speech and what seems appropriate, consistent? Somewhere halfway between the two. It is operating on a text basis. So first it transforms speech into text, and that text is compared to an extremely large number, about 20-some thousand different forms of questions or sentences or other utterances that would be realistic to be said to a patient in the given setting. And instead of just looking for a match, it is trying to identify that as those questions are arranged in various topics with a particular appropriate answer, which of this topic, this particular form of question that was just asked by the learner most gravitates to. So that's how the matching algorithm works. It's not a dumb matching, but rather an advanced AI-based neural network-driven matching.
Can I add a little anecdote to that, Balazs?
Sure.
I always, so just a few weeks ago, my wife and I had her cousin's daughter over for dinner, and she's 9 years old, and she was curious what I did for work. So we showed her, one of these digital patients, and, this is a 9-year-old. She's asking all of these kind of off the wall questions that, no one would ever really think to ask during a medical interview. And at one point she asked, how's your guinea pig? And the system, the AI was actually able to understand the question and then respond back, no, I don't have any pets, actually. So to give you kind of an idea there on how smart the system can be, I always like to share
that. Does it check whether the learner is using appropriate auscultation points positions? And that's honestly related to the can the system score the learners? Yes, you can. Not, as you could see, it does log whether they used appropriate lung, heart, or bowel sound positions, are all different areas for the listening to these vital sounds. And we can tie that into the assessment criteria that drives the calculation of the percentage scores you can see here. Another question about that, whether that's customizable. Absolutely. All the bundled patients come with a pre-established complex set of criteria and learning objectives. Every learning objectives may require a combination of various actions happening during the session, either in a particular order or in any order, or certain elements following others. And if that happens, then certain points of credit will be given. All this is combined together for the high-level learning objective scores that you can see here. And as every element of the patient or the patient scenario process, you can fully customize it and create your own patients as you wish. So does the faculty or educator formulate the rubric of scoring, the items used to score the score? Yes, through defining a learning objectives for the particular patient, but most importantly, it comes with a large number, up to 16 patient scenarios for all kinds of patients with very different needs. Some of them more communications focused, others chest pain cases needing more direct physical assessment and action. And all of those come with pre-established learning objectives for out-of-the-box self-assessment and practice. When assessing soft skills with patients who may have anxiety or be upset, what are your thoughts about that? It's a very good point. We didn't mention that you can control some of the nonverbal communication elements in the digital patient responses, which can indicate and provide hints around these anxiety or being upset and all that. One part of it that is obviously just using a different language and terms, but by being able to add facial expressions and changing those facial expressions depending on what was asked, we can really build this emotional connection to a much higher level. Can a machine make human medical decision? That would take us way beyond our time frame. Maybe not today, eventually, definitely. But can a human run faster than a horse? Depends on the tools they use. Does the scoring allow for time frames that the student should accomplish certain activity within? Yes, absolutely. We have time-based requirements. That's actually a relatively recent addition to the system, that you can set minimum or maximum amount of time between certain events as they are unfolding. Wonderful. Is it possible to switch to another language? Very interesting question. To be perfectly honest, the AI is highly tuned to be best with English, but we do have a certain level of support for speech functionality in 12 other languages. So it can verbalize and it can transcribe in those other languages. But maybe its level of understanding of what's really going on as of today is not as deep as it is with English. But obviously all the other elements, physical assessment, orders, everything else can be changed to any other language. And with that, if there are no more questions, then I once again, do you have a set number of avatars? Yes, in a short demo, we cannot really show them all, but Nick, if you have the waiting room scene somewhere that you could pop up while I'm talking about this, that would be great. We have 8 different avatars as of today, starting from the elderly patients, all different kinds of genders, ethnicities, and other shapes and forms, and all the way to pediatric patients. And one of the most important new avatar we recently introduced is not only a 10-year-old child, but also visiting the clinic together with her mother. And depending on what the learner asks, some questions are answered by the 10-year-old patient, others by her mother, and some by both with different answers. So this is a unique combination.
Sorry, just a second. Here's the there's the image of the kind of our waiting room scene. So you can actually see all of the different patient avatars that we have. Can you see that?
Yep, and all of these avatars are available for in any combination of all the environments: the clinic, the hospital, ambulance, and the home environment for telemedicine applications. And or you can combine them any way you like. Thank you. Thank you again.
Great. So the only other thing that I will add, unless if there's not any other questions, is that if anyone would like to see a more in-depth and personal demonstration of the Spark software, I'm happy to set those up with you guys and your broader faculty. So I will send out an email, I think, letting you guys know.
Yeah, that question, the last question, is this commercially available, really tells that we weren't really pushing a button that, and we were more talking about how exciting all this is. Well, actually, this is widely used at quite a few nursing schools, medical schools, and other healthcare education institutions with hundreds, if not some days thousands, most days hundreds of sessions with learners running on this platform. So from institutions like UCSF and other and then UC Berkeley and many other places, University of Cincinnati, University of Colorado, they're all using it, and it is very much in production. This is not just a research topic we're happy to share.
Balazs, did you want to touch on the question from Chris about the physical assessment?
Incorporating haptics for the learner. We are actually adding all kinds of enhanced reality elements to it. We have a basic virtual reality support. And with that, we're having some basic elements of haptic feedback there as possible with the commercially available VR controllers. Expect something interesting to happen around sometime this year. I cannot really tell more. Thank you very much, and
all right.
Have a wonderful rest of your day, and have a great IMSH Delivers 2021.
Thanks, everyone.